there's lots of different reasons why someone might have joint pain. It might be something simple from like an injury or an overuse injury, but there are other causes: osteoarthritis, bursitis, rheumatoid arthritis. There's ligament injuries. The time to be worried is if the pain has lasted more than a few days, or if there's any swelling or warmth of the joint, or any redness, or difficulty getting on with your day-to-day activities because that's being limited by pain. So we start to try and work out what's causing your joint pain by doing a full history, trying to work out, were you well beforehand? How did it start? Is there pain? Is there stiffness? Is there swelling? Followed by a physical examination in the clinic room, and then we would want to decide what investigations are necessary, and that might involve blood tests, it might involve x-rays, ultrasound scans, MRI scans. From there we would be able to try and work out, come together and work out a picture of what the diagnosis is most likely to be. Treatment options for joint pain really vary. It may be something like physical therapy that you need with seeing a physiotherapist. It may involve having a steroid injection. It may be painkillers, or it may require disease modifying agents if you have an inflammatory arthritis or connective tissue disease or vasculitis. The important thing is to make sure that the diagnosis is correct so that we get the right treatment plan in place. For me, it's very important to make sure that all those decisions are made in conjunction with the patient so that they're happy with the plan going forward. Yes, absolutely. Joint pain can be a sign of arthritis. It can be, and there's different types of arthritis. There's an inflammatory arthritis, like rheumatoid arthritis or psoriatic arthritis, and you can get some arthritides that are associated with connective tissue diseases, and it can be more wear and tear arthritis, something like osteoarthritis. Sometimes crystals form within the joint, and that is a condition called gout or pseudo gout. So taking a history and examining the patient and getting investigations underway early help us to make the diagnosis earlier to stop any long-term damage happening to the joints. Lifestyle can make a big difference to joints. Things like making sure you're a healthy weight, having a good diet that's rich in anti-inflammatory foods, so lentils and pulses, and things rich in omega-3 like fish, and cutting down on processed food. They can all make a difference. There's some evidence for having turmeric either as a supplement or as within the diet, helping inflammation. But really just focusing on oneself and trying to maintain a healthy lifestyle in general, like cutting down on smoking, ensuring that your alcohol intake is within the recommended limits, can all have a massive impact on patients' well-being and on their joints.